Yes, it's a study on self-reported workability among cancer survivors treated in young adulthood. And it's a questionnaire-based study. And we included patients treated for breast cancer, colorectal cancer, melanoma, non-Hodgkin's lymphoma, and leukemia in the period 1985 to 2009, and asked them about their about several late effects and their current workability.
Okay. And what were the general trends that you saw?
The main results is that there are many both psychological and somatic factors that impact on the self-reported workability, both late effects but also other conditions.
Okay. And how did those vary across the disease type?
We didn't find significant associations between the disease type and the workability, except for those treated for non-Hodgkin's lymphoma, which had increased risk for having lower workability. But I think that's it's because there is a more indirectly effect of the treatment. To more intense treatment give a higher risk for some late effects that we found were associated with having lower workability. So it's more the effect goes through the late effects and not directly from treatment or disease. Yeah.
Were there any other factors related to poor workability recovery?
Female gender and having a lower educational level was also associated with having impaired workability.
I guess that just comes down to the broader sociological barriers to returning to work for women anyway.
Yes, I think so. And also there were a lot of or I think about half of the participants were female treated for breast cancer, which also might have impact on that result.
And what was the kind of general response among patients who were completing these self-assessment forms?
The patients were identified through the Cancer Registry of Norway, and we sent them a mail questionnaire and they send it back in a prepaid envelope. So we actually don't ask them if they are happy to answer the questionnaire or not. But yeah. No, it would be a speculation. So, yeah.
So I guess then the question is what do we do with this information going forwards? If we are coming up with treatments and regimens for patients, trying to get them treated adequately, but also with a high ability to continue with a healthy, normal life going forwards after their treatment. What does this mean for further research?
We have some specific rehabilitation programs in our health region to help cancer patients and survivors back to work. I think many cancer survivors also struggle with staying at work over a longer period. I think there's needed efforts on several levels. I think both informations to general practitioners and the welfare system that helps people who have trouble with their work situation. Knowledge about that cancer survivors might experience late effects that might impact on their workability. And also specific programs, rehabilitation programs that might help cancer survivors to have a better workability. And I think if you can also have better system for detecting and treating late effects of treatment, that will also probably give a better workability.
I suppose, as a final note, what are your thoughts on having an ESMO session at this conference specifically for survivors of cancer and helping people in their life after cancer?
Oh, I think it's fantastic that also ESMO acknowledge that life after cancer is an important issue. So, yeah, I think that's very nice.